And welcome to Health Professional Radio. I'm your host, Neil Howard. We're going to have a conversation this evening with Dr. Dan O'Brien, and he's joining us on Health Professional Radio to talk about the rising trend in telemedicine, particularly now with the COVID-19 pandemic happening. Welcome to Health Professional Radio, Dr. O'Brien.
Thank you for having me. So I'm a physician and professor and also a medical futurist. So as a medical futurist, looking ahead at different healthcare technologies, including robotic technology, digital health, as well as telemedicine.
Well, this COVID-19 situation, this pandemic has given rise to several technologies. I mean, lots of people are talking about Zoom. It seems to be the go-to thing for teleconferencing now that there is such an emphasis on social distancing and keeping each other safe.
Yes, exactly. Zoom, and obviously through telemedicine, which actually is a virtual visit between a physician and patient. So just increasing the access through technology, through kind of these virtual visits, whether it be Zoom or, FaceTime with your physician, is just really increasing the access to healthcare right now.
Do you really think that telemedicine is going to prevent the future spread of COVID-19, being a medical futurist?
Yes, it's certainly, according to the literature, it's headed that way. Particularly looking at physicians that get contracted with COVID-19, they're actually able to stay at home and still be able to see patients that way. And even in regards to patients not overcrowding the ERs or other clinics, especially for non-urgent matters, telemedicine is a great avenue for that.
Is this what we're hearing from the front lines as far as public health officials and the CDC?
Yes. Literature has shown that 84% of individuals usually, want a provider that has a telehealth solutions. So the CDC is very supportive of a technology like telemedicine.
Is it as effective in non-emergency, non-COVID-19 situations? Because, other situations are still going on that have nothing to do with COVID-19. Is telemedicine just as effective in those instances as well?
Exactly. Especially to your point, for these non-urgent matters, it's really crucial, especially even for reevaluation or follow-up. Telemedicine is a great avenue to go. Again, it's increasing the access, potentially decreasing cost, and also preventing a lot of this overcrowding of ERs and clinics.
We hear so much about our healthcare workers who are becoming infected. We talk about the swatch of the population, different swatches being more susceptible or less susceptible, but our frontline workers, our healthcare workers, are more susceptible in my mind than anyone. Can those who have been infected still utilize telemedicine and be effective while still coping with their own level of the disease?
Yes, exactly. I give the example where 90% of my peers are utilizing telemedicine, and some of those individuals, could be contracted in different parts of the country, right, with COVID-19, and they're able to actually work from their own office in their home while they're being quarantined, while still having virtual visits with patients. So even those healthcare workers that are infected, whether it be nurses or physicians or other healthcare providers, they certainly can still communicate with their patients while they're still social distancing and quarantine as well.
Mm-hmm. Well, let's talk a little bit about some of the high-risk patients. Are they still candidates for telemedicine? They're high risk, but not yet needing hospitalization.
Sure, yes. Just to be perfectly candid, it's really important for a physician to be able to kind of triage, is this a low, medium, or high risk patient, through kind of that initial conversation. And so I think that's why it's important for telemedicine to almost be that second follow-up. Maybe your first initial visit is with your physician, and maybe a second, subsequent visits can be done telemedicine to make sure that the patient kind of has the capability of the technology.
So what are the patients saying in a time such as this? I mean, there's lots of fear, lots of uncertainty. As a medical consumer, we're used to a bit of hands-on, even if that hands-on is as limited as a 15-minute visit.
Right. According to the literature, patients think really that during this time that the sacrifices that they're making, I really give it to a lot of those patients that they're making the sacrifices to stay at home, especially for these non-urgent matters. And I certainly recommend anything urgent, to seek out your provider, live. But for these non-urgent matters, patients are really sacrificing during this time. And I think Americans have done a great job with social distancing and listening to policies, listening to the CDC as best as they can.
When we were talking a little bit about non-COVID-19 related visits, being useful in a telemedicine setting, what about some of the mental health issues that are still ongoing? And of course, some of them that are going to be caused by the pandemic when it comes to telemedicine.
Yes, you raise an interesting point. With the amount of people, practicing social distancing, we're seeing actually an increase in depression and anxiety. And that's where what's known as telepsych can really be valuable in the fact that these patients can really reach out to their provider in regards to a virtual visit to talk about maybe some of their depressive or anxiety symptoms that they're having, especially during this time, since there's a lot of fear and there's a lot of social distancing as people are trying to kind of find a supportive social network during this time.
What do you think the next phase for telemedicine is, especially with the situation changing daily, changing by the hour sometimes? Is telemedicine without limitation?
Yes, so COVID-19 is very fluid, right? We're learning so much. And I think the wave and what we're going to see in the future is just more how digital apps and maybe a potential application of telemedicine. And this is really, I believe, going to be the wave of the future. And this may be the new normal. As healthcare, it's not going to be the same. I think there's going to be a lot of changes post-COVID-19.
How do you think telemedicine is going to become intertwined with AI during this, as I think we're going to call it, the coronavirus era?
Right. Great question. I think that intertwine will be with AI as we look at various outputs, right? So if we look at kind of machine learning algorithms, as we plug in those algorithms, take a person's clinical symptoms, take their genetic makeup, put all those various things into kind of a algorithm, I think that will be able to spit out an answer, right, for the clinician. And that will kind of actually verify to a clinician that, hey, am I on track for this particular diagnosis? And I think the provider will be able to communicate that information via telemedicine. So it's really an exciting time, particularly for AI as we look at predictive outcomes. Could we be able to predict another pandemic like COVID-19 through the use of AI, artificial intelligence? And how we kind of communicate that information via telemedicine will certainly be an interesting connection.
Do you think this is the situation that will facilitate at least the possibility, the very real possibility of all of us being always connected to some type of app or algorithm so that our health can be tracked efficiently by our healthcare providers via telemedicine?
Yes, I certainly do. I think because of this and looking at kind of post-COVID, I think people are going to become healthier. They're going to be more aware. There's going to be more education out there. And it may be a positive thing for individuals to realize the importance of taking care of their health and even keeping up with some of their vaccination schedule.
Is there a place where we can go online and start to get more information about telemedicine and how it's becoming more and more prevalent, especially now, and get some more information about you, Dr. O'Brien, as well?
Yes. So my website is drdanmd.com, where some of those articles are. And then also you can follow me via Twitter at drdanmd1.
Great. Well, thank you for joining us here on Health Professional Radio this evening. It's been a pleasure speaking with you, and stay safe.
Yes, thank you for having me, and you have a good night.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Dan O'Brien, talking about the rise of telemedicine in the coronavirus era. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.